Hi, everyone, and welcome to this webinar session. TechNet 21 is happy to welcome our colleagues from PATH and NEPI Vietnam to discuss the digital transformation journey for EIR in Vietnam, nationwide scale-up and paperless transition. If you have any question, so next, please. Thank you. If you have any question during the presentation, please use the Q&A box. It's available at the bottom of the Zoom window. Ask your questions anytime. Our panelists will answer them after the presentation during the Q&A session. There's also a chat box where you can already introduce yourselves if you want and tell us where you're from. And if you need any technical support, please let me know in the chat box too. And I'm here to help you. Finally, this session is recorded. We'll share with you the links to the video as well as the slides after the session, obviously, probably early next week, and by email. Dr. Nga will start this session with an opening speech. Then we'll show you a 6-minute video on the journey of NIIS. This will be followed by the presentation. Mr. Sang and Dr. Huyen will tell you about the nationwide scale-up and paperless transition for about 30 minutes. Then the panelists will answer your questions in the Q&A session, and Dr. Nga will close the webinar. I hope you'll enjoy this session, and I'll give the floor to Tu, who will introduce you to the speakers. Tu, the floor is yours.
Thank you, Alex. Good morning, good afternoon, and good evening. This webinar is facilitated by Dr. Nguyen Tuyết Nga, Southeast Asia Hub Director from PATH. And she also the project manager of Ideal Vietnam project. Now, prior to her leadership role in Vietnam Country Office and now the Southeast Asia Hub, she has shared deep passion and dedicated many of her work in vaccine and immunization program at PATH in Vietnam and region. We are also honored to have here Dr. Đặng Thị Thanh Huyền, Deputy Director of the Vietnam National Expanded Program on Immunization. Her dedication played an important role in leading the digital transformation and taking charge of the National Immunization Information System. Last but not least, we will be listening from Mr. Đào Đình Sang, Ideal Vietnam team lead. This NIIS journey started shortly after Sang started at PATH. He has been working tirelessly the past decade as the essential link to coordinate the digital transformation, speaking the language of both healthcare workers and IT technicians, both the public and private sector, both manager and facility staff. And lastly, as we are excited to share our story, we also hope to learn from all of you. To start, let's welcome Dr. Nguyen Tuyết Nga for her opening remark.
Hello, good morning, good afternoon, good evening, everyone. It's our pleasure today to host our final webinar for IDEO project. So thank you for your participation today. And I'm sure that many of you already attended the many section or webinar for our IDEO project, or even visit our IDEO landing page in the TechNet website. But for some of you who join us for the first time, PATH has been supporting national EPI for almost 12 years for national immunization information system, from early stage of designing, development, pilot, and then nationwide scale up and paperless transition. So during that journey, we have been facing a lot of challenges, barrier, also success and also failure, and still now even we are in the last stage of the digital transformation, paperless transition. During that journey, we have got a lot of support from different donors like a Bill and Melinda Gates Foundation, UNF, GSK, also Gavi. And today we would like to present some of our and share with you some of our lessons learned for the last step of the digital transformation for NIIS, nationwide scale up and paperless transition. Also share with you that how we address the challenge during COVID-19 pandemic. Let's start. Let's have a quick start with the video of our journey and then we can listen the presentation from our panelists, IDEO team, including Pat and
Ladies and gentlemen, we would like to invite you on 12 years journey of digital transformation system in Vietnam. The development, deployment, and transition to electronic report. At the start of this journey for our National Immunization Information System, let's return to 2011, when the foundation of the system, the VaxTrak, was built within the provision of Optimi project funded by the Bill and Melinda Gates Foundation, with a collaboration between WHO, PATH, and the National Expanded Program on Immunization. VaxTrak was a standalone application built on WinForm platform, require end user to install app on the computer. The VaxTrak supported end user to track all vaccines and stock transactions from national down to district level by lot numbers. The app also helped to consolidate vaccination results. Initially, VaxTrak was piloted in 3 provinces and then scaled up to 10 other provinces in January 2012. In 2013, VaxTrak was upgraded to web-based application and scaled up to all 63 provinces nationwide, with 7 provinces applied the system down to the district level. For its preliminary assessment, the system was highly evaluated and showed its efficiency and accuracy in vaccine tracking, specifically matching between vaccine dose reported versus actual in stock went from 77 to 100%. Pre and post implementation. Furthermore, the time for reporting reduced significantly when using VaxTrak. Immunization registry. Parallel with VaxTrak, ImmReg was developed to track individual immunization. The application was piloted in 17 communes in Ma Cày Nam District, Bến Tre Province. At that time, most of the communes did not have the computer. Thus, the application was built on the web-based system for district staff and on Nokia cell phone with QWERTY keyboard to support GPRS network for commune health staff. In the pilot phase, ImmReg focused on immunization registry and EPI subject management at commune health center, including children from 0 to 24 months old and pregnant women. Main functions include client registry, searching for existing client, planning for immunization session, creating list of children clients due for vaccination, and sending them SMS reminder. Post-rollout evaluation on ImmReg showed that the software had reduced the time for reporting significantly from 30 minutes to only 1 to 2 minutes. And the most important result was the increase in on-time immunization coverage. These are the inevitable outcomes that the listed below system benefits bring about. Integration of VaxTrak and ImmReg, the Vaccine Management and Immunization Registry System. With the successful rollout of both VaxTrak and ImmReg in 2014, under funding from the UN Foundation, 2 softwares were integrated into one comprehensive system to manage vaccines and immunization down to the individual level and upgraded with additional functions to manage children and pregnant women. After the integration, the system was expanded to 164 communes in 9 districts of Bến Tre Province in 2015. The National Immunization Information System. After the successful pilot in Bến Tre Province, the MOH officially requested PATH to coordinate with and provided technical support for NEPI and Viettel to develop the National Immunization Information System, and the NIIS was then scaled up nationwide in 2017. The NIIS was then upgraded and used for all facilities provide immunization services and birth delivery services, including public and private sectors. The NIIS added some new functions such as barcode scanning, dashboard, and e-immunization card. After 5 years of implementation, the NIIS had recorded 31 million subjects on the system and has been operated at about 15,000 immunization facilities nationwide. However, most facilities across the countries have to use both the NIIS and the older paper-based system in parallel. Ideal Vietnam 2018 to 2022, introducing digital immunization information systems, exchange and learning from Vietnam. Late 2018, the Bill and Melinda Gates Foundation granted PAC the Ideal Vietnam project with the goals to support the continuing transformation to the complete paperless immunization information system and to disseminate lessons learned from Vietnam to other countries in the region and in the world. To support the transformation to digital reporting, the system has standardized the transformation procedures, enhance essential system skill set for end users, and ensure data quality and data use. With all the activities to standardize the procedures, equip knowledge and skill, as well as mobilize resources to improve infrastructure, all the immunization facilities in Hanoi and Sơn La province have used NIIS in replace of paper reporting.
Mr. Sang, the floor is yours.
Good morning, good afternoon, and good evening. So on behalf of the Vietnam team, I would like to share with you digital transformation journey of the EIR in Vietnam. And let's learn to focus on the nationwide scale up and the paperless transition phase. So my presentation have 4 sessions: electrolytic immunization registry in Vietnam. So we call it the National Immunization Information System, or NIIS in the short name. As you may know, the NIIS in Vietnam, we have 12 years journey, and this journey you have just watched the video, so I don't want to repeat this again. So you know that the majority of the low to middle income country pass the pilot phase of the digital health scale, and some going to scale up or moving to the paperless. So in this presentation, we just focus on the phase of the nationwide scale up and the paperless transition. So in Vietnam, the technical working group to form at the very early phase of the NIIS. So technical working groups include representatives from the different agencies. They contribute the expertise to design, develop, and implement the NIIS in the nationwide scale up. So we continue to maintain and strengthen the role of the technical working group. So the technical working group to support MOS to develop the planning and roadmap for the implementation. They also develop the regulations, the policy related to the NIIS implementation in Vietnam. You know that we never have the perfect system at the beginning to meet the end user requirement and also the change in the policy. So we need to maintain the partnership with the mobile network operator to ensure the system operates fully, upgrade the system on time. the local partners collaborate together to collect the feedbacks and the challenge, as well as discuss to find the appropriate solution to overcome the challenge during the scale up and develop the guideline SOP to improve the data quality and for the data use. The NIIS is the online and the web-based application. So it requires the end user to have a computer or device and good internet connectivity. So the local government need to prepare and ensure the IT infrastructure and equipment ready to when the scale up nationwide. Then they conduct the series of training to build the capacity for how the worker are very important. The local authority with the limited resource, end user with the poor IT knowledge and skill, and that the end users are at different level, and even that is the different facilities the same level, they have their own learning pace. So the 1 day in-person training, we usually provide the 1 day the training for the end user. But the 1 day the training is not enough time for end user to digest the own function of the system. So they need much technical support when they start using the system. So the other countries may consider the other approach like a virtual training or e-learning to build the capacity. Seriously, I will talk with you more about this approach later. Due to the limited resource for the implementation, the local government should mobilize the resource, budget from the enterprise, charities organization, or mobilize the resource and the expertise from the international organization in your country to support for the implementation. Under ideal project with funding from the Bill Melinda Gates Foundation, we support the 2 provinces, Hanoi and Sơn La, to move forward to the paperless reporting from the 2018 to 2022. November last year, we conducted final evaluation, and here, so I would like to share some the key findings and lessons learned for the paperless transition phase. So Hanoi and Sơn La province successfully transitioned from the paper-based system to using the NIIS, while maintain or improving the data quality and the data use. Both the province authority was very committed to direct the own facility to move paperless reporting for immunization. From January 2020, the own facility transit to the paperless. That's in the 2 provinces. And I would like to be noted that the pre and post intervention here, I mean, that is like a before and after the paperless transition. It does not mean the before and after the NIIS introduced. And we conduct the baseline and analyze survey to evaluate the pre and post paperless transition. In terms of the data quality, we look at the completeness, timeliness, and accuracy. Here are some of the findings you can see the most improved significantly. However, you can see the accuracy of immunization information in Hanoi reduced a bit. It's maybe due to the Hanoi have a heavier impact of the COVID-19 outbreak, with high the number of the COVID-19 cases. And Hanoi they have several times lockdown and the social distancing in comparison with the Sơn La province. And that the immunization staff in Hanoi were mobilized to track COVID-19 cases and also the patient contacts, as well as they have to mobilize for the COVID-19 vaccination. So maybe that is the supportive supervision conducted during this time, like during the paperless transition. And you can see significant improvement in data use in the both province before and after intervention, from the 30% to 100% in the paperless transition, and users maximize the utility of the NIIS for their work. The data from the NIIS was not only the UC to report, but also the end user UC to make a monthly vaccination plan and to make the plan for the campaigns or the catch up the vaccination after the like during the COVID-19 the vaccination. So many try to miss the opportunity to get the vaccinations on time, so that they can use the NIIS to plan for the catch up the vaccination. And manager at the district and province, they report that they use the data from the system to evaluate the performance of the health facility to identify the priority for the supportive supervision. And we also conduct the cost analysis, and this estimation of the cost for the NIIS implementation in Vietnam. So you can see the cost for the training and implementation as a major cost. But the ZST estimation is based on the small sample size. So I think that is the we need to conduct the bigger survey with the bigger sample size, so that we can show the comprehensive picture in Vietnam in the cost for the NIIS implementation. So now I would like to share the lesson learned from the paperless transition. To get success in this phase, we continue to strengthening the commitment of the local authority and ensure the systems operate smoothly and linkable with the other system to exchange the data. So when we scale up the nationwide, the database increase stably. Facility as a province, central, province level or central level have a challenge in the querying reports. So we need to partition the database server as well as optimize the performance of the systems. That is very important when we move to paperless transition. And that's in Vietnam, to own public and private sector to provide birth delivery and immunization service have to use the system in the Vietnam hospital, and the private sector contribute a lot for the birth registration and immunization, especially in the urban area. So to engage the curative and private sector to involve to increase the uptake of data into the system, very important task to have a comprehensive picture of immunizations in the country. And data quality is critical to move paperless. So we need to provide the training to increase the awareness of the end user manager at the levels about the data quality, how to improve the data quality as well as the cultivate the behavior of the data used from the system. And MOS need to be the focal point to work with the related department, ministries, to advocate to legalize the report data from the system, as well as the issue the guidance, direction, the regulation to the paperless transition for immunization facility in this phase. As a spin-off from the digital transformation of the immunization information system, an e-learning platform were developed to help immunization staff to catch up with the system update, training, refresh training on the system functionality. The system was more important during the COVID-19 outbreak. Similarly, the staff are familiar with the different online tools. Virtual supportive supervision has become the essential format for frequent check-ins through the social distancing. E-learning platform. The e-learning system is developed with the aims to enhance the knowledge and skill of the health workers on NIISU, to improve the data quality in the NIIS, and also the candidate data use, maximize the utility of the data from the NIIS for the planning, management, and the decisions making. And of course, the e-learning system that can help to save the time and cost for the trainees in comparison with the on-site training. E-learning also support a lot for managers at a higher level, can monitor the learning progress of health worker at a lower level. So now here's some lesson learned. So we shared with you in development and implementation of the e-learning system in Vietnam. The system is overloaded as increasing the number of end user login and learn from the system at the same time as the learning is under the consideration to scale up its scope and its estimate number of users should be taken into the account for the appropriate server and bandwidth requirement as well as the system capacity evaluation. Moreover, the user classification and the assignment for different regions and levels are needed to ensure the system functioning properly. Limited the IT skill of the health worker, particularly the elderly staff. E-learning was built on the web-based platform, so that could be accessed on the web, the browser, on computer or smartphone. It is also the designed with the more user friendly. So that is the even that is for the elderly staff, so they can easy to use the system. Furthermore, the system continue to collect the feedback, collect feedback from end user to improve its interface, cost content, and other matters related to the system implementation. It's very costly if the e-learning content developed with the combination of the voice recording, animation, professional graphics design. So we just can to create the e-learning contents by simpler ways such as the voice over PowerPoint. And other challenge is the voice recording that we face. If we use the voice talent, so we have to recruit the voice talent, and it's often delays the progress or the challenge to keep the content in consistency if the content is changed a bit. So when the content is changed, so we have to work with the voice talent to record the voice again. So that is the when the make the consistent of the voice. So in this challenge, so past we have explored AI the service to transform the script to voice to ensure the consistency throughout. And so one the challenging and lesson learned to that is the end user the motivation to use the e-learning system. So how to activate the end user the motivation, the user the system proactively. So MOS choose the officialized certificates from the e-learning the system the value they add in the person training. So that they can motivate the staff to engage more with those e-learning platform. So e-learning platform that can use is to narrow the gaps created by the limited resource in terms of time, funding, and manpower, providing the more equitable training to healthcare staff regardless of the location. The system is not suitable for the trainings on clinical and practical topics. The implementer need to clearly understand that the e-learning that cannot replace in-person training the system completely. This platform is very compatible and helpful for the training related to the health information system, the training or update new guideline or more the conceptual the content. So e-learning that can provide the additional and the more flexible access as well as the cost reductions for the training. For the project implementation, the frequent supportive supervision is also the chance for the direct and constructive feedback to improve the system. But initially, the work has a plan to utilize the virtual supportive supervision for the capacity building of immunization officer. Virtual supportive supervision to narrow the gap in the time and geography to provide the timely and efficient support, the supervision to own level immunization tabs on the NIIS. Furthermore, the seed approach is very helpful in the context of the COVID-19 outbreak or the other outbreak. There are different platforms. So can we use for we can use it for the virtual supportive supervision. In Vietnam, we use the Google Meet. Most of that the Google Meet have a very helpful for the users in Vietnam. because that the is the with support for the vulnerability and the attainment at the same time. And here's some the image from, you can see some image on the slide from our different session of the virtual supportive supervision session. Besides bridging the gap in geographic time adherence to social distancing, the benefits of using the online platform also include the increasing the frequency of the supportive supervision, particularly for the supportive supervision on the system. It was very helpful with the screen sharing function where we can observe the staff operate the system on the screen. And here I could be mentioning the challenge unique to virtual supportive supervision in Vietnam with the IT infrastructure with a limited resource facility should mobilize the resource from and share with the different program, like they can share or to mobilize the computer from the different program, the different project, and some facility even that they mobilize the staff, the personal, the laptop or smartphone, rather than they equip the new device because due to the limited resource. It is very challenging if the no guideline or SOP. So we our project develop the SOP guideline, describe detailed steps such as the planning, scheduling, preparation for the virtual supportive supervision, like a technical equipment of computer, camera, speaker, and so on. So like if the people they don't, the facilities they don't have speaker, the louder speaker or the microphone on their computer, so they can combine with their smartphone and with the computer, so they can hear, they can speak, and they can share the screen on their computer, so that they can discuss the problem and review the data together with the supervisor, as well as develop the online checklist form for the supportive supervision to record and store the findings from the supervision, then they can follow the afterward. Even the virtual supportive supervision are very helpful, but it cannot replace the on-site supervision. For example, provide the technical support during the immunization session, like observe vaccination technique. So, but it's very good for the implementing the digital system, software, and data assurance, data review, and check with the end user, so they can provide technical support via the virtual supportive supervision approach. And that's all I want to share with you. Thank you for your attention, and welcome to your question. Thank you.
Thank you very much. So this is time for the questions and answers. Dr. Nga, I'll give you the floor to moderate the questions and answers. And there are like already some questions in the Q&A box. And I saw there are some questions also in the chat and that you already replied to them. But if you want to address them orally, you're very welcome. The floor is yours.
Thank you. Thank you, Alex, and thank you, everyone. One of the good question. So I already replied for the first question about costing data. So as you know that if you have visited our IDO landing page in TechNet website, we see several of our publication already there, and now we are working on the final publication for the project, including the costing data, and we hope that we will be able to share that with you via the landing page. Check the landing page next time. And the second question about the NIIS check the COVID-19 vaccine, maybe I invite Dr. Huyền to answer that. Dr. Huyền, please.
Yeah, so, hi everyone. So nice to see all of you. And I see a lot of colleagues in this room. And so, yeah, we the NIIS at the beginning, we used for the national immunization program, and then we introduced the COVID-19 vaccine in 2009. 2021. So the IT developer, they have already built the COVID-19 tracking system within the NIIS at the beginning. But anyway, because you may know the population size in Vietnam is very big, around 98 million. So, and then they need to move and do it, separate it they separate the data, but the structure and other thing is almost the same with the NIIS, include the NIIS, including not only for the immunization registration, but also for vaccine management. Yeah. So yeah, we have other question about the link to birth registration and antenatal care. So this system is in the clinic, like a community health center, as well as the hospital where the children was born. So we request on the hospital or health facility to register on the birth to the system. Now there is no birth registration system in Vietnam. So this is the one that we request on the health facility to register birth to this system. And if the children that was born in the home or outside the facility, so they will be registered in the system later on. So maybe that is for Happy Margaret. And the next one, I see the question from Bunaventura Nestori. So yeah, the internet connectivity coverage in the country. So now is almost more than around 98% of the facility they can connect and they provide with the internet. So there is a very small number of the facility without this at the beginning. So after that, we have requested the IT service provider. So they have provide some 3G or 4G device that support to the health facility to connect with the system. And now almost, I should say 99% of the health facility, they can connect with the system. But anyway, in some areas with low speed, so they have some issue with the access the system. Sometimes not all the day, but sometimes they get some difficulty with this. So I come with the next one. What is the approach of strategy is for facility with the connectivity? So yeah, I have already mentioned about 3G or 4G device that allow the facility can connect to the system. And the next one is a last question from Rashab. So how did the transition paperless system help Vietnam to achieve universal health coverage? Yeah, sure. And can this show the issue inequity in assessing health care? Yeah. So you know that this system not only used in the freelance vaccine within the EPI, but also sorry, in the fee-based services. So we include the own data from the fee-based services system as well from within the API. So we have a more and more data from year to year to see the true coverage in the community. So many years ago, we cannot manage the data from the fee-based system. So we're not sure that about the coverage or immunity in the community. So but now we can have such data from both fee-based and EPI. So we can see every child which dose they miss or which antigen they miss. So it means that we manage by antigen rather than vaccine within the API. So yeah, it's helped to also identify the inequity or marginal population. So it helps us to improve the data quality. And you know that when a child registers in the system, so the health facility where the child will live, so they will be notified about this case, so they can contact with the parent and to remind the parent to bring the child for the further immunization session. Yeah. The question from Happy Margaret. So there's a backup of live version of NIIS, and did the IT infrastructure in Vietnam support the NIIS? So years ago, we have a live version, as Dr. Sang have already mentioned, but now we have no, because the internet coverage is almost very high in Vietnam, and almost a health facility, they have their own computer, desktop, so it's suitable for them. And now in the near future, and now we have already developed one app in the mobile phone, so that allows to the community health center and healthcare workers, they can enter the data in the mobile phone with the scan barcode or something. They can connect with the system. So it's good for the healthcare worker. They can use even for their own mobile phone for the work, and they can enter the data in the outreach immunization post. Thank you. And the last one, I see one question from Maya Chanta. So are the children provided with a unique identifier code? Can be tracked if the immunization count is low? Yeah, sure, very good question. So every child or any person registered in the system, they will have an unique ID. So that is automatically generated by the system. It's based on the code of the province, code of the name, the year of the children born or other things. So they will be generated automatically. And another app we have developed for parents that is connected to the system. So if the parent with the number phone register in the system, so they can install the app and then they can download the information of the immunization into their app. Any person with such a number of phone, so they can get the information. Example, for one family, if they have 2 or 3 children, and even for her for mother, if they register the same number, so in app they can show the information of all 3 or 4 persons. So mother can know which dose the children have already get and which is still need. And in the near future, so when we use the app for the healthcare worker, we can scan barcode in the app so that it will allow to connect directly and to find very quick the record of the children in the system. And I see the next one. What is the government framework around the registry? How is confidential maintained, particularly if healthcare can use their own phone? Sure, this yesterday we have already very long discussion with Pat on this. I think that iPhone smartphone is very good chance to how to generate and scaling up this database. But anyway, we need to secure the data, and we need to show that all the app don't collect the personal information like their movement or their other personal information. So we request the ID service provider, that they need to check whether the developer have already met the own requirement of the safety and secure the personal data, to sure that they don't collect any personal information before we launch this app. And of course, we need to submit to the MOS and maybe other authority to check whether the app is available and they can connect to the system as well. They are safety for the user. And currently we have a decree that's related to the system. So this decree, in this decree, they mention data in the, so to say, that is official data. So yeah, before any, so we need to have a policy to state that the data is official from the government. So it's the worth data for the personal use or for the even for the public health. And the last one I say is the e-learning course accredited. Yeah, someone have already answered this, and yeah, sure. So yeah, all questions have been already answered. And if you have any further question,
Dr. Huyền, still one more question. They put in Dr. Mahmoud on Masum. Put in the chat, what the target of children for EPI, the annual birth cohort? The annual birth cohort for EPI, is it 1.7 million?
Yeah,
right?
it's around 1.5
every year.
Yeah, now every year we have around 1.5 million, but we need to serve not only 1.5, but we need to serve for children under 1, children from 1 to 2, and then we have a pregnant woman. So every year we need to serve around almost 4.5 million or more. That's the only NPI, but also we need to serve this system also serve for the other group. So from at the beginning, example for our system this year, at the beginning we record around 29 million, but now we have more than 32 million of the record have already in the system.
Thank you. And actually, I see the one question, the last one, but it's, I don't know how somehow it disappeared. Related to the e-learning. So at this moment that national EPI is one who manages the e-learning system.
Yeah, sure. As you know that we, for building capacity, especially for the grassroots level, is very hard for owners. Because in example, in Vietnam, we have more than 11,000 of common health center with some people in every commune. And also we have almost 2,000 of hospital with the many people they involved for the birth delivery, as well as the hepatitis B, birth dose, and BCG vaccine delivery. So, and plus more than 1,000 of the fee-based service facility. So we have a lot of people, and we cannot provide the training to all face-to-face to all the people. Even we have already some training for all province, all the district, and all the commune. But anyway, we need some refresh training. So, and also that's not only training, but also technical support. And why we need to have a different way to different approach, so that we give the technical assistance to the own low to grassroots level, So e-learning is a good platform that we can use to share the knowledge and also the SOP and other guidance, so that help to the user and practical. It's more practical in this way. Yeah. Especially in the COVID-19 pandemic context, so we cannot come and provide on-job training or somehow. So e-learning is a good approach, so we can share the information and have the facility.
Dr. Huyền, there's still one question in the chat box. If you can open the chat box and see. How helpful was EIR in tracking zero-dose children or those who missed the vaccination during the pandemic?
Yeah, sure. In the system, we not only registration, but we have a module that allows us to planning for immunization session. In this, they will recall for all the children with the missed dose. During this planning process, so every common health center, they can know and track the children with missed any dose of the NEPI vaccine, and they will make the list, and also they may the system so they also send notification over the app for the parent to remind the parent about the dose that they need to come for the vaccination at the common health center. And so, yeah, so during the COVID-19, we have, I should say that we have some backsliding from COVID-19 with the lowest vaccine coverage. For more than 20 years, we experienced that. And in this year, we have already discussed with our partner, and so we try to improve vaccine coverage, as well conduct the mopping up for those who miss any dose. So we have requested the common health center, they check to all the children with the any missed dose of the NEPI vaccine, and the system can have that.
Yeah, and there are one more question in the Q&A,
Yeah.
Dr. Huyền.
Yes, I didn't say. This is, I believe, the delay schedule. I want to know upon what age group provide vaccine to national. Yeah, very good question. So in Vietnam, we provide most of vaccine for children under 1. But anyway, we allow to provide the dose for the children under 2 years. But anyway, now we start discussion with our partner international organization to start the school thing for the immunization history. So that will start very soon this year, and we will work on more on this in this NIIS and how to use this data for the development, develop the new module on this. So that allows us to check the immunization history of all the children at the school entry of the kindergarten as well as primary school. So we expected that we can have a such module next year, and how to connect this NIIS with the other system from the Ministry of Education and Training. Yeah, so that is our ongoing work. So we'll maybe share with you later.
Thank you, Dr. Huyền. I think that's all for the question you received, and also we almost out of time. Thank you very much for your participation today, and for all of you that who have been providing support for the NIIS during last 12 years, not only for the last step. So this is our final webinar, and we look forward to sharing with you more. Still more three more lessons learned coming up, and also one final publication for our project will be posted in the IDEO landing page in the upcoming months. Thank you, and back to Alex.
Thank you very much, Dr. Guna. Thank you very much for everyone for this insightful presentation and answered questions. As a reminder, we will send the links to the recording as well as the slides by email to everyone. And in case you have any question regarding IDEAL, you can reply to my email and I will put you back in touch with Tu or Dr. Nga. We will provide also the link to the IDEAL web page in this email so that you can see all the material that is already there and look for the next publications. We will do some promotion on the TechNet 21 website, on the forum, and perhaps also on the relevant Telegram channels. Thank you very much, everyone. I wish you a very nice rest of the day and a very good evening to all our friends in Vietnam. See you next time. Bye-bye, everyone.
So yeah, thank you very much for your attention today. And yeah, sure, I know that some countries now they are interested in the develop immunization registration system. So I'm very happy if I can share and help you on this, because behind this presentation, that is a 5 years journey to work from. That's not 5 years, but I should say that more than 10 years we have already committed in at the beginning. So thank you very much, and we are happy to share with you and have, if you interact in this, so we will share with you more and more. Thank you.
Thank you, Dr. Hien. I can add your email address in the mail that I'll send to the participants if you're fine with that. We will discuss by email. Thank you very much, everyone, and have a very nice rest of the day. Bye bye.
Thank you and bye bye.